Kasaragod എല്ലാ പ്രേക്ഷകർക്കും മെഡിട്രാക്കിന്റെ മറ്റൊരു എപ്പിസോഡിലേക്ക് സ്വാഗതം. ഇന്ന് മെഡിട്രാക്ക് ഡിസ്കസ് ചെയ്യുന്ന വിഷയം പീഡിയാട്രിക് ഡെന്റൽ പ്രോബ്ലംസിനെ കുറിച്ചാണ്. ഈ വിഷയത്തെക്കുറിച്ച് കാസർഗോഡിന്റെ പ്രേക്ഷകരോട് സംസാരിക്കുന്നത് കണ്ണൂർ ആസ്റ്റർ മിംസിലെ പീഡിയാട്രിക് ഡെന്റിസ്റ്റ് Dr.Piyusha. Welcome, ma'am.
Namaste.
See, ma'am, today we are going to discussing about pediatric dental issues. Could you please explain about your department?
Okay. I am Dr.Piyusha Patil. It is called as pediatric dentist or pediatric specialty dentistry or pedodontist. What it is basically?
Yeah.
So it is a age-defined specialty where we provide preventive and therapeutic oral health care needs to infants and children, including those with adolescents. And also those with special health care needs. Okay. So it is a age defined specialty. Matlab you usually see kids from 0 to 20 years, that is from birth till they grow. Okay.
Yeah. Here is see from birth itself. See when the parent should be bring the newborn child to visit the dental doctor.
This is the most common question.
Yeah.
Because at birth children don't have teeth at all.
Yeah.
So which is the ideal time they have to introduce the children to a dentist or they have to visit a dental clinic.
Yeah.
Many have a myth that they have to visit a dentist only when a problem arises.
Yeah.
Like the child has any cavities or anything, black tooth, anything like that, or the child falls and he breaks his tooth, anything like that. So those are the issues when parents think they have to go near a dentist.
Okay.
But this is wrong. So the first visit ideally is when it is 6 months to year of age or when the first tooth for the kid comes out in the mouth. Okay. This is not like a treatment kind of a visit. It is more of a awareness kind of a visit. So when there is no problem, nothing, the kid visits a dentist. It is like a small trip to a dental clinic.
Yeah.
They are not going to have any bad experience. There is nothing painful or there is no sound, nothing. Okay, just a friendly talk with a dentist, which helps in giving a positive reinforcement for the kids. So first visit ideally should be from 6 months to a year or when the first tooth erupts in a child's mouth.
See, one of the major issues are decay. Okay, so what are the causes of decay?
Yeah, decay is one problem which we commonly see in kids. Okay, so there are 3 things which come into play. Okay. One is the local factors.
Yeah.
When we say local factors, those are the
local factor means
that is the food we eat.
Correct.
Which what the kids eat, how many times they eat, that is how frequently, like morning till evening keep on munching, or keeping the food in the mouth, something like that. Okay, that is the local factors. The time duration, time is that keep on eating continuously, one after the other, there is no break. So the teeth is continuously exposed to the sugary food stuff, where the bacteria can produce acids. And the other thing is that the hygiene maintenance, if they do not brush properly, if the food keep on getting stuck on the teeth, so over a period of time the bacteria work on it, produce acid, and that leads to decay formation. For a kid, especially in the age group of a year to around 18 months, the more common decay is the feeding bottle decay or nursing bottle decay, what we call as, where a mother, because to soothe the child or anything, she put the baby with breastfeeding or bottle feeding and allow the child to go to sleep. That time what happens is the milk starts pooling especially on the upper front teeth. It is not cleaned, it is there for a long time. So that leads to acid production and decay. This especially is seen in the upper front teeth.
See, these are the only symptoms of decay. This one. What are the other symptoms of decay?
The initial thing what you can, if Parents are very careful. If they observe the child's teeth, what they can see are white lines.
Yeah.
That is the initial stage.
Okay.
When the mineral loss starts,
Okay.
the white faint line starts to appear on the tooth.
Okay.
So that is the initial decay. From then there will be tooth loss, there will be that brown cavities, black cavities, everything what you see.
See, ma'am, how to detect it when say from this one changes of coloring teeth, okay, that directly we can understand. Then how to detect the decay?
Detect, basically parents have to observe the child's teeth often. Okay. While brushing they need to see.
Yeah.
Okay.
Correct.
In case because of time restraints or they brush and they move on, at least once in a week or once in 15 days, how is their kids' teeth, they need to see. If they don't see, if they ignore, and if this cavity progresses, then the child will suffer with pain.
Okay. Then how to treat it, ma'am?
Okay, treatment, there are numerous treatment depending upon the extent of these cavities.
Yeah.
Okay. If the parents get the child only when those faint white lines are there, there is no treatment required. They just have to do slight dietary changes, improve in their oral hygiene, and there are few products, preventive products, which I'll be explaining. They apply that and then we can stop the decay.
Okay.
When there is a mineral loss, when there is a tooth structure loss, then there is an option that if there is little bit of tooth loss, fillings are possible.
Okay.
There are 3 layers for the teeth. First layer is the enamel, second layer is the dentine, and inside where nerves come into picture, that is the pulp. So when the decay is in the enamel, it is treatable, just filling is enough. When it involves the dentine, still we can clean it and fill it up.
Okay.
Okay, the child may experience slight sensitivity, nothing much.
Okay.
When it involves the pulp, that is when the infection starts. That time filling is not possible. We do what is called as pulpectomy or pulpotomy or root canal treatment. That is, we clean the inside part of the tooth completely of the infection and fill it up.
Okay. See, this one root canal treatment, at any age we can do it?
That's a good question. Yes, many kids, many parents have this, that small kid, is it safe to do a root canal treatment? Basically, root canal treatment is done so that we remove the infection. Keeping an infection in the mouth is not safe. Keeping an infection in the mouth, one thing is it will lead to extraoral infection or fever or some other complication for the kid. And the infection itself, it will hamper the growth of the permanent teeth, which are just above the milk tooth. So, treating the infection is more important. Root canal treatment is a pretty safe procedure, which we even do for kids if required below 2 years of age. Okay. So there is nothing to worry in that.
What is the need of root canal treatment below 2 years? Because that
as I said, nursing bottle caries. Okay. The feeding bottle caries. Okay. These are the early caries.
Okay.
Sometimes if the kids, the teeth usually starts to form at the age of 5 months. As early as 5 months they erupt in some kids. So if they are not taken care of properly, if they are not brushed properly or maintained properly, then you will see decay as early as 1.5 years.
Okay.
Where the tooth would have completely damaged because of cavity, and if it gets infected, if pus-filled infection forms in the gums, then they need treatment.
See this root canal, that procedure. See, that teeth I have seen that there is no sensation, just the appearance is there. Is it? Could you please explain about that one, ma'am?
Okay. See, basically, why we do root canal treatment? Why milk tooth we do root canal treatment? Why do we have to save it?
Correct.
Okay.
Why should
because
we are saving?
Parents always think that this milk tooth is going to fall off. Anyways, we are having another set, permanent set of teeth. Why this milk tooth has to be saved with root canal and other procedures? Milk tooth, they have lot of functions to play. One is it helps for the normal chewing of the food. Second thing is the looks. Okay. Third thing is the speech. So what happens is, if the kids lose a milk tooth pretty early in life, there will be space loss, what we call as. Milk tooth is basically required to maintain the space. See, the permanent teeth are below the milk teeth. So the milk teeth, they are very important to maintain that space for the permanent teeth to come in that position. Okay, they guide the permanent teeth to come. In case the milk teeth is lost early, that space has to be maintained. If it is not maintained, then the adjacent tooth slowly they move into that position which we call it as space loss.
Okay.
That leads to the permanent teeth either coming in a different direction,
Okay.
or sometimes it gets blocked. There will be no space and the permanent teeth cannot come out.
Okay.
This leads to the later on problems like crowding of teeth, other things.
Okay. See ma'am, how to prevent this kind of decays, tooth decays?
Yes, prevention is always better than cure.
Yeah, correct.
Okay.
Yeah.
So we have to give a lot of importance on prevention.
Yeah.
Okay. First thing is, most important thing is brushing. So we can question at what is the right time to start brushing.
Okay.
Okay. It is from birth onwards.
Yeah.
Birth, there is no teeth,
Yeah.
but the parents can massage the gums of the kid.
Yeah.
Okay.
Yeah.
Then when the first
That time without using brush,
using brush or anything, just with a finger, massage
Just
the gums of the
massaging, yeah,
teeth.
correct. Okay.
Next, at the age when that first tooth erupts, you can start with finger brushes.
Yeah.
Okay, they are very comfortable. You get finger brushes which you can put it on your index finger and slowly clean the tooth and the gums of the young kid.
Yes.
Okay. Slowly move on to kids toothbrush, then adult toothbrush. Those are brushing is first thing.
Okay.
Next is toothpaste.
Okay.
Okay. So
Now before that, before going to toothpaste, which brush we should use?
for kids nowadays there are n number of things which are available in the market.
Yeah.
You should always go for the soft bristle one.
Yeah.
A small head one. Okay. Big head, the adult toothbrush doesn't fit in the kid's mouth. That is wrong. Use a specific kid's toothbrush which is soft bristled.
Yeah.
Okay. If the kid is not comfortable with the brush, it feels it's very big to keep in the mouth, then start with the finger brush. Finger brush are pretty comfortable to use.
Okay. Okay.
Okay.
Regarding toothpaste?
Toothpaste, basically it is the brushing which is more important.
Okay.
Toothpaste, it is just a added on top of it. Okay, to like a lubricant kind of, you can say.
Yeah.
Okay, to feel good while brushing and to feel that freshness after brushing.
Okay.
Some kids, they do not like toothpaste also.
See, why I am arising this kind of doubts means, ma'am, in market many toothpaste are here. So we
Yes.
actually we are confusing which one we should select, which are the proper toothpaste used for this brushing. See, any suggestion that one, not I am not a brand is this particular toothpaste is good, not that one. See, how to prevent decay, for that purpose, which one we should select?
Okay, see, yeah, that is very confusing for the parents.
Yeah.
Because so many toothpastes are available. Any toothpaste is okay. Before 3 years, we do not prefer a fluoridated
Yes.
toothpaste.
Okay.
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 Because adult toothpaste contain lot of fluoride in it, and kids, they don't know to spit. They usually swallow. So before 3 years, we don't prefer a fluoridated toothpaste.
Yes.
We get many non-fluoridated toothpaste in the market. You can choose one of it.
Okay.
Okay. After 3 years, we start with fluoridated toothpaste. The size of the toothpaste matters. Okay, in case you are using a fluoridated toothpaste.
Yes.
So till around 5 years, we just say smear the brush with the paste. Just smearing it, just touching
Okay.
it. Okay.
Okay.
Then after around 5 years, we say pea-sized amount.
Yeah.
That is what is sufficient.
Okay.
Not more than that. You shouldn't put whole brush surface with the toothpaste. Okay, pea-sized is enough.
We will take another topic. That means teeth grinding. See, we have seen teeth. How it happen? Why it happen? Is there any special treatment for that one?
Teeth grinding, yeah, many parents have a question where kids feel like it is making sound while sleeping. Cut sound. They
correct.
feel like they are grinding on the teeth continuously. This is pretty normal for the kids in the early ages. Okay, we don't intervene before 3.5 years if we don't see any problem. Okay, this is n number of factors come into play. Okay, if the kid is not it has a slight stress or some anxiousness, it is a soothing effect. Other than that, the teeth will be erupting. Okay, there will be at around 6 to 8 years there will be exchange of teeth where milk teeth fall off, permanent teeth come. That there will be slight irritation. For that also they grind their teeth. Any kind of cold, cough or anything like that time also kid tends to grind their teeth. So as long as it is little minor, nothing to worry. But if the parents observe that the teeth is getting worn off, there is loss of tooth structure, then it's better they get a checkup done near a dental clinic. Okay, there are appliances which we use after around 3 years which prevents damage to the teeth from grinding. That only if required the doctor will suggest.
Okay, see, any special treatment for that one?
It is something called as a night guard.
Yeah.
It's a transparent tray which we fit in the kid's mouth. Okay, it is custom made. We take a measurement and fabricate it. So it is placed in the child's mouth, and this prevents from grinding habit. Okay, but we don't give this to very young kid because it is a choking hazard. It's a soft, flexible material. So we don't prefer it in a younger kids.
Okay.
So only if required, only there is a lot of damage to the teeth. Then after observing, we'll decide for it.
Okay. See, man, so we have seen that habits of kids, whether it is good or bad, we don't know. Okay, see that finger sucking, thumb sucking, like that is coming. It will affect the teeth.
See, habits basically why it develops in the kid. Okay, habits form because they need something to hang on to, something soothing.
Okay.
So this finger sucking, thumb sucking, it's kind of comfort, giving comfort for the kid.
Okay.
That's why in the early stages they go on to those sucking habits. Sucking habit is pretty normal in the early stages of the ages of the child. Okay, but if it continues,
is it bad?
Yes, if it continues beyond 2.5 to 3 years, it is bad because it affects the growth of the upper and the lower jaws.
Yeah.
Okay,
Yes.
this sucking over here, it causes a negative pressure
Okay.
when we suck.
Okay.
So it narrows the upper arch. Okay, leading to crowding of the teeth.
Okay.
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 And sometimes there will be mouth breathing habits in kids where they keep their mouth open. So all those kids leads to malaligned teeth.
Okay.
Okay.
Such a
So we
habit,
need
how
we
to
need to
control
intervene.
it or how to prevent it? Any special, any treatment for that one? Any counseling?
For habit breaking, the first thing is to make the kid aware that they have this habit. Okay, we cannot suddenly put up a appliance. That is like a punishment for a kid. Why? They don't know why they put it. So first we make the kid aware that, see, you have this habit anta. Okay, so any habit which prolongs after 3 years, that time we'll start educating the parents and the kids that this is not right. You need to come out of this habit. So once we make the kids aware, still it is very deep rooted. They are not able to come out of it. Then conservative approach, like putting socks on the hand or using that asafoetida, they say. That bitter taste, to get that bitter taste, so they stop keeping it in the mouth. Those are the simple measures we try.
Okay.
If that fails, only then we go for an appliance.
Okay.
There is a very simple appliance called as a bluegrass appliance, or those are tongue creep appliances which prevent the thumb from keeping inside the mouth.
Okay.
These appliances, minimum duration we have to wait till 6 months. Okay, then we can see the result. But usually within 2 to 3 months, the kids come out of those habits.
Okay. See, ma'am. Another thing is we have seen that misalignment teeth, crowded teeth, then protruded teeth. See, when we should start to check this kind of things.
See, what happens is that in milk teeth, nothing is there. Milk teeth, it is usually normally aligned.
Yeah.
Okay, so we don't realize it.
Yeah.
It is usually in the permanent teeth when you feel like it is not coming properly or anything like that.
Okay.
Okay, so usually when upper 4 teeth and lower 4 teeth comes out, that is a more ideal time to check for any kind of malalignment or any kind of crowding, or in case if crowding can occur in future. Okay, so anything to be intervened. Usually you can say around 6 to 8 years is the ideal age to review for this. Other than that, after a few years, the parents, the child automatically, the moment they see, they can detect those crowding.
Misalignment or crowded, automatically it will be solved.
Automatically, what happens is that crowding doesn't get corrected by itself, because it is where natural growth has gone wrong.
Yes, correct.
There is some problem in the growth pattern because of which this crowding has happened. So there is something called as preventive orthodontics or interceptive orthodontics. These are the early stage orthodontics, okay, where we have a slight specialization in that field, where we check kid at the early age. If we see that yes, crowding can form in the kid, or they are more susceptible to getting a wrong arrangement of teeth, then we explain the parents. There are appliances which correct the habits. There are appliances which take away the bad forces falling on the teeth and get the natural growth pattern into correct direction. Okay, these are early interventions.
See, if it is the early intervention, means that without the treatment, it will be okay.
Without treatment, without braces treatment, you are saying. Yes, yes. These early interventions we do, majority of the times, around 60 to 80% of the times, we can avoid fixed braces.
Correct.
Okay, but what happens in early intervention is we do it in a very young child. So the cooperation of the parents as well as the kids is very important.
It depends upon that.
Yes. Whereas in braces we fix it on the tooth, and the kids are little older age. So that cooperation thing is less in that. They have to come for follow-ups. It is more of our activation of the wires and that thing which works. Okay. But when we are doing in early stages, parents and the kids cooperation is very much required. Their motivation, we have to keep them motivating. But the advantage of it is when we do the correction early, we avoid braces treatment. Sometimes we avoid extracting the tooth. If space is less, sometimes we extract the tooth to create space. So sometimes we can prevent extraction. We can expand the arch in the early stages. Many things are possible if we do it at the early stage. There are advantages. Okay.
Okay, so see, what are the advanced treatment for this one, for kids, this kind of
we do
issues?
There are a number of myofunctional therapies, what we call as. These are appliances which bring about changes in the muscle flows and the growth of the orofacial structures. They work in a holistic way, where the first they correct the bad habits like mouth breathing, tongue thrusting, those things. Then they take out the wrong forces from the tongue, cheeks, lip muscles away. Then they allow for the normal growth to occur. So few examples to give them are the trainer systems. These are the trainer appliances. Then there are double oral screens. Then there are face masks. So a number of appliances are there which we use for early corrections.
Okay. See, what are the other types of treatment?
The other thing is the normal braces kind of a treatment which many parents are familiar with, where we place braces on the teeth and bring about alignment. Other than that, now there is a newer thing which is coming up, is the Invisalign or clear aligner something like. Okay, where we don't put braces on the teeth. Those are transparent trays, which these are all preformed. Okay, we take the measurements of the patients. Okay, then we check what all corrections are required. Accordingly, we make those transparent trays, which the person has to wear it 24/7. He has to remove it only while eating or drinking. And there will be a set of trays given and followed up by the dentist, and the correction occurs. The advantage of this is braces are not there on the teeth. So there is no diet restrictions or anything. Aesthetically good. Okay, there are many other options available.
See, another issue is that early loss of milk teeth. How to resolve that one? Any special treatment for that one?
Sometimes parents come late. Okay, so there is completely tooth has been destroyed. We cannot save the tooth. That time when there is loss of teeth, early loss, to prevent the space loss, to maintain the space for the permanent teeth, there are appliances available which are called as space maintainers. Okay. There are different types of space maintainers for with teeth, without teeth. So that as parents prefer, we will fabricate and give.
See, ma'am, we have seen that kids are fallen, that time teeth break, that time. Then how to treat, how to resolve that issues?
Kids are always active, so you cannot stop kids from running around or playing around or falling around. Okay. That's too difficult of a task. So they tend to fall. So sometimes they tend to break their teeth also. So what is the treatment for this, Andre? See, any trauma, if it occurs, the early we go for treatment is the best results. We get the best results. For kids, a small minor fracture, anything like that, usually we do not treat. Okay, we may apply just a slight bonding agent, we call it, or something, and leave it. If there is any root exposure or anything like that, so again it will require pulpectomy or root canal treatment or anything. In case the tooth completely comes out, the tooth hole comes out when it falls, we call it as avulsion. In milk tooth, we usually don't place the tooth back. Okay. But this trauma, it differs in a permanent tooth. After 6 years, when a permanent teeth, so a kid with permanent teeth falls, then the treatment differs. Okay. So depending upon the fracture, how much the tooth has fractured, there will be conservative line of treatment like fillings or root canals or anything like that.
Excuse me, ma'am. Suppose see certain cases we can see the half broken teeth.
Yes.
Such a situation, how to treat? What are the treatment options?
See, if the roots are not exposed, the inner part, what I said, pulp,
Correct.
if it is not exposed, starting is the conservative treatment. Okay, where we just apply a material for the tooth to heal.
Correct.
And we follow. In case the tooth gets infected because of trauma, if the nerves get damaged and the tooth gets infected, then we have to do a root canal treatment. There are some cases where the permanent tooth is completely knocked out. Many a times.
Correct.
This is very, very important scenario where people doesn't know what to do. Okay. At the time of accidents, if the tooth has fallen off, first very important thing is find the tooth, and get it to the dental clinic at the earliest. How to get it is they have to either keep milk is the best solution. If they can find milk anywhere and place the tooth in the milk, best. If they don't get milk, they can use patient's own saliva, the person's own saliva or water. Get the tooth to the dental clinic, the same tooth we can place it back. This is called as reimplantation. We can save many tooth loss by doing this. So
that is the proper way to bring the teeth to the hospital.
The proper way is milk is the best solution. If not that,
milk is the best way.
Milk.
Then water or
there are
saliva.
other things like HBSS solution that is not easily available. Then there is a honey beeswax solution that is also not easily available. So easily available for general public will be milk, person's own saliva or water.
See ma'am, like that any preventive method is there?
We cannot make the child prevent from falling, but we can make the home trauma friendly or safe. That is avoid sharp edges. Avoid slopey areas. Round off the edges, or we get these rubber blocks where we can cover the sharp edges. That will prevent the intensity of the trauma. So these things you can do it, make the home safe, make the area safe. Other than that, when the kids are sports active, as they grow they will be sports active. So encourage parents and kids to wear mouth guards. You can see sports person, other people wearing mouth guards, but we don't usually use it on a daily routine. But if we try to inculcate those mouth guards, they're just we take the measurement and fabricate it. They are very, very cost effective. So it will prevent lot of traumas using mouth guards, helmets. So all these things help in kids who are sports active.
See ma'am, differently able to child, any special treatment for this hospital?
Yes, this is a specialty hospital where we have experienced doctors and staff, where we are trained to take care of kids who are specially abled or differently abled. Where the cooperation is less chair side. For them we have options to treat the kids under general anesthesia. We have a very good team of anesthetists, OT setups, instruments, everything, and staff, support staff, where we can render the treatment very safely and reliably.
മെഡിട്രാക്കിൻ്റെ ഇന്നത്തെ എപ്പിസോഡ് ഇവിടെ വൈൻഡപ്പ് ചെയ്യുകയാണ്. ഈ എപ്പിസോഡ് കാസർഗോഡ് വിഷൻ്റെ പ്രേക്ഷകരോട് സംസാരിച്ച കണ്ണൂർ ആസ്റ്റർ മിംസിലെ പീഡിയാട്രിക് ഡെൻറ്റിസ്റ്റ് ഡോക്ടർ പീയൂഷ മാഡത്തിന് കാസർഗോഡ് വിഷൻ്റെ നന്ദി അറിയിക്കുന്നു. അപ്പം എല്ലാ പ്രേക്ഷകർക്കും നന്ദി, നമസ്കാരം. താങ്ക് യു മാം.
താങ്ക് യു.